want to thank everyone for joining us in today's webinar. I'd also, of course, like to thank the funders of Cochrane Canada, without whom these webinars, our training, systematic reviews, and capacity building could not happen. Thank you to CIHR for their support. I'd also like to thank PAHO, the Pan American Health Organization, for kindly providing the Blackboard software for our webinars. And a special thank you to Luis Gabriel Cuervo, who converts these webinars into YouTube videos that are then placed on our webinar archives. The recorded versions of these are generally online in 2 to 8 weeks. Without further ado, I'd like to introduce today's webinar on Cochrane 101, an introduction to the Cochrane collaboration. Today we'll be hearing from Al Mayhew. Alan Mayhew is the managing editor for the Cochrane Effective Practice and Organization of Care Group, otherwise known to us as EPOC, which is based at the Ottawa Hospital Research Institute. Al graduated from the physiotherapy program at the University of Toronto in 1981 and completed his master's degree in epidemiology in 1999. He has been involved with EPOC for the past 8 years and has a particular interest in the inclusion of non-randomized studies in systematic reviews. Al, it's a pleasure to have you here, so please go ahead.
All right, I was just freaked out today and happy to give this presentation to you. Really impressed that there's 113 people who have joined this webinar today, and I hope I'm able to meet your expectations and go from there. So as Eileen mentioned, this is an introduction to Cochrane and giving you a sense of what it is. We're going to start by going over some of the historical aspects of what is Cochrane, who was Cochrane, and what is the collaboration all about, and also to give you a sense about the collaboration systematic reviews and how we function as an international network, helping both patients, professionals, and all sorts of healthcare providers and other consumers and policymakers and who are involved in making well-informed decisions. And just give you a sense of the magnitude of how big an organization we're talking and how we work together to disseminate, produce, and update these Cochrane reviews. And so I hope that meets everybody's needs for today. So this is a picture of Archie Cochrane, who, as you can probably guess from now, the Cochrane collaboration was named after. And Dr. Cochrane had some concerns about there being all this evidence out there, but we were unable to sort of put it all together and develop critical summaries. And that was his big concerns way back in 1979, that how do we prepare information so that it's all put together for the medical profession and now for all people so that we can summarize, so that we can collect together and summarize all the results of different randomized controlled trials so that as a group summary they can be used to better inform decision making. It was the idea behind the formation of the Cochrane collaboration, and as you can guess, was named in his honor.
Hi Al, sorry to interrupt you, but we're getting a few people saying they can't hear you clearly. So if you could just speak up a little bit.
Sure.
Thank you.
Is that better now?
I think so, thanks.
Okay, I'll turn up my microphone a little bit as well. Just a sec here. Okay, I'll try that and see how that works there. Okay, so on to my next slide. This is the logo of the Cochrane collaboration, and again, I'm sure many of you are familiar with it and have seen it before. And in 1987, the year before Archie Cochrane died, he referred to a systematic review of randomized controlled trials during pregnancy and childbirth as being a real milestone in the history of randomized trials and evaluation of care, and suggested that all of the specialties and all the practices should consider the same approach, which again led to the formation of the Cochrane Center. This logo is actually really helpful, and again, I'm sure a lot of you have seen it before, are quite familiar with it. But just a couple of points I wanted to draw out about it. One is the inner part is basically showing how the data from a meta-analysis is produced. Okay, each of these little white lines going across. Each of these little white lines going across represents one individual study, and the range, or the confidence interval, or the range of possible effects from the results of that study. And this little diamond at the bottom is a summary, again, with obviously a narrower confidence interval because it's included all the studies together. And this line going up the middle is basically a line of no effect. So depending on how the graph has been set up, it either shows that all the interventions together suggest the intervention is effective, or the studies together suggest the intervention is not effective. But it can go in either direction, and this diamond helps to summarize that really well. The other factor here is the outside of the circle, which kind of makes the point that the Cochrane collaboration is an international group, and that we are forming a big C of Cochrane and another C of collaboration, but also the whole idea of a big circle summarizing all the available evidence. So that's kind of the background behind the logo and what it stands for. A lot of people have spoken very highly about the Cochrane collaboration, including David Naylor, who felt that it's an enterprise that rivals the Human Genome Project for its potential implications for modern medicine. Really a nice way to be able to get the data or the evidence in terms of effectiveness of interventions, and now moving on to things like diagnostic tests and other things. There are over 28,000 people in 100 different countries who contribute to the Cochrane collaboration. And I'll probably say this a couple of times, but the international collaboration, the international cooperation is really an important aspect to this group. Okay, so that any reviews that are written have to consider the international perspective. Because I'm sure, as you're all aware, the healthcare system is very different in one country versus another. There's always some similarities, but especially when you get into more complicated reviews, looking at the effect of those possible interventions may be different depending on the setting of the country that we're talking about. So that's why I think this international collaboration aspect is just really, really important. So this is a definition about what we do. Okay, an international, which I talked about before, not-for-profit organization. So we don't pay people to write our reviews. Okay, those who do get funding and manage to get them through other research grants or through other sources. Okay, which aims to help people, not just professionals, not just policymakers, but all people make well-informed decisions about healthcare by preparing and maintaining and promoting the accessibility of systematic reviews on the effects of healthcare interventions. Okay, it sounds a bit like a long title, and whenever I read it, I always think what is most important here. But again, it is international nonprofit, and we're helping people make well-informed decisions about their healthcare. Okay. So that if someone has some questions about a certain medication, they've either been recommended by their family doctor, or they've heard through grapevine from their friends or families that some medication is good or not good for a particular condition, they can access the Cochrane Review and be able to go into it and see what the information on it says. We work really hard at being collaborative. We want to encourage participation and build on the enthusiasm of individuals. I mentioned earlier that many of the contributors are volunteers. Some are doing reviews to support their other research. Other people are doing reviews because they're interested in a specific topic. Excuse me. We try to provide information that is relatively biased, reliable, and up to date. And furthermore, we try as much as we can to make our reviews as transparent as possible. Because what we really want to strive for is to make it easy for people to read a review and to understand what we did. They may not always agree with the findings, but we want them to be able to understand what we did and how we got there and make the reviews as transparent as possible. So what is a systematic review? Okay, a systematic review is a review of a clearly formulated question that uses systematic and explicit methods to identify, select, and critically appraise relevant research and to collect and analyze data from studies that are included in that review. Now, this definition comes right out of the Cochrane collaboration. It's the one we go with, and it can be found in the handbook in different areas like that and other things. It's a very generic description of a very rigorous method that we try to follow, so that it's really clear and really transparent to people reading it, whether they're lay people, whether they're health professionals, about what it is we're trying to do. I used to talk about the difference between a systematic review and a filing cabinet review, whereas filing cabinet review is when you write a paper and you pull out the 3 studies in your filing cabinet that you already have in your hand that you've found through whatever source, and you say, this is what I found on the effect of aspirin and pain. The trouble with that is it's really hard to duplicate, okay, and it's very hard for a reader or another author to get the exact same results. And the point with a systematic review is it can be duplicated, okay, that I could read a systematic review, say, okay, I understand how Dr. Smith got these results, carry out the same review, and then assumably get the same results. And I think that's a real advantage to that we want to make the reviews as clear and explicit and as systematic as we possibly can, and so people understand what the process is. So this is my break time for a quick second, and just to get an idea on who I'm talking to, I know there's now, I'm trying to see numbers, up to 116 of you. So if you can give us a sense of who you are, whether you're a scientist, practitioner, policymaker, consumer, etc. And if you just want to tick in the box up on top, and we'll get a sense of who we're dealing with here. Thank you. Okay, that's really helpful. Thank you. Interesting that nobody labeled themselves as a consumer, and yet I guess we all are. I know that whenever I have any health issues, I often, and I talk to my family doctor or other health professional about it, I'll also go to the Cochrane Library and see what recommendations they give. So, I guess that's the other issue. Well, nobody identified themselves as a consumer. So anyway, there you go. And 45 people identified themselves as having none of the above, so that's good too. So hope this is helpful for everybody. Thank you for that. Who are we? That's a really good question. I guess we're all sorts of people that are involved in the Cochrane collaboration. We're scientists and researchers. A lot of people will conduct their reviews because they're planning on doing a future clinical trial or future study, and they want to get a good sense of what the literature is out there already that maybe either affect how they design their study, or maybe the results have already been found. And we have a lot of researchers wanting to do that. We have practitioners who get involved in carrying out reviews, again, because they're interested in a particular topic. Policymakers in some of our more policy-oriented reviews. We do have some reviews within the review group I work at that look at things like the effect of on-screen computer reminders on health professional behavior, or the effect of audit and feedback on professional behavior, things that will change how people act or how professionals will work. We have consumers and public people involved. All of our reviews include plain language summaries, and a lot of review groups will use consumers to actually help to write them or help to look at them and read them and see if they do in fact contain the information that consumers will find helpful. We have administrators, coordinators, staff who help to carry out make sure the process of the reviews are going on, as well as the dissemination activities. We have a lot of librarians involved in our group. As you can probably imagine, doing searches requires somebody with certain expertise, and these librarians are really helpful to be able to do that. We do have students who are involved in Cochrane Review. Again, I mentioned earlier that a lot of the scientists are doing reviews to justify or rationalize their future questions. A lot of times we have PhD students or other students who are interested in carrying out a study for their PhD and decide to do a Cochrane Review again to get a sense of the literature that's out there. Over 28,000 people in over 100 countries, and the vast majority of them are volunteers. Okay, I'm not sure how many Cochrane Reviews this little person in front has done, but I do not. I'm joking. But obviously, you know, we do often have meetings. We try to get together and do as much collaborative work as we possibly can, so that people are able to do that. Largely funded by government grants. We do have some affiliation with the World Health Organization. A lot of the researchers who are doing reviews manage to get their funding from other sources, such as government grants, depending on the country they're in and whatever, World Health Organization. We have a very decentralized structure. We do have the main secretariat and the Cochrane editorial base in the UK. However, as I mentioned, there's a whole lot of different Cochrane Review groups. There's 53 of them, and they're based in all different parts of the world. There's some in Australia, some in Canada, some in South America. There's an Ibero-American Cochrane Center. As well as the review groups who actually write the reviews, we also have a lot of support from different methods groups, Cochrane Fields, centers, which are regional areas of Cochrane activity, and a consumer network, which again is very international and spread all over the world. Okay, next slide. Bit of a schematic here about how the group is set up, or the big Cochrane collaboration is set up. So we have the steering group at the top, which is as I mentioned earlier, includes members from all around the world in different parts. People actually apply and run to be part of the steering group, so that they're able to do that. And then from the steering group, which is made up of representatives from all these other different Cochrane groups. We have the centers, which again are regional centers of excellence, or centers of Cochrane activity. So there's a Canadian Cochrane Center, there's a UK Cochrane Center, there's an Australasian Cochrane Center. We also have fields, methods groups, Cochrane Review groups, and the consumer network, which I think I'll go into in a little bit more detail in a second. So there's 53 different Cochrane Review groups, and we're the ones who actually write the reviews and prepare them for preparation. We don't write all of the reviews in our group, but we do work with authors around the world who will write them. Okay? And they tend to focus either on a specific health topic or a specific health system. For example, there's a back group, and they do reviews related to back care and back injuries and interventions related to that. There's a public health group, which has more broad interventions looking at public health issues. And there's a hypertension group, which is also based in Canada, and they will look at reviews that will affect the treatment of hypertension. So the effect of a certain drug on hypertension, the effect of exercise on hypertension, that sort of thing. These review groups handle the process of conducting and publishing the reviews, as well as provide support, okay? Providing methodological and editorial support to different review authors. There's 53 worldwide and 6 in Canada. I should also mention the back group is also based in Canada, as well as the hypertension group and 4 others. I once, a few years ago, went to this presentation on the difference between publishing in the Cochrane Library and publishing in a journal. And I kind of thought, oh yeah, we'll see how this goes. And there was one really fascinating point that came out of this to me that I'm just going to take a second and share with you. People who publish in journals send the paper to the journal when they're done. Okay, so you finish up, if you're writing a systematic review, and there are journals around that do publish systematic reviews, you do all the work on it, and then you send it to the journal and see if they want to accept it or not. The Cochrane approach is very different. We accept reviews at the title stage. So you would email the back group and say, I want to do a review looking at the effect of exercise on low back pain. If they decide to accept it, it provides support to that team doing the review right from the beginning. Okay? So we help support you through the protocol stage and then through the peer review process, leading all the way to the review stage and publication with that. I'm sure many of you are aware of the advantages of publishing protocols before you publish a review rather than just publishing the review, which I know a lot of journals are getting into now. But I thought the whole concept or the whole idea that it's a good idea, the Cochrane approach is to accept the project at the title stage when you initially start, rather than later on with as a journal would when you publish it at the end. I think there's a role for both, but I think the approach is just really different and really fascinating to think about. Cochrane also includes methods groups. Two that we mentioned here, there's a biased methods groups and non-randomized studies methods group. One of the things I think we all realize is that methods are going to continue to evolve and can continue to change. And I can tell you there's been a lot of movement in the past 5-6 years looking at both the risk of bias criteria, which is essentially our quality assessment technique. There's been a lot of changes in our plain language summaries. There's been a lot of changes in our summary findings tables, which actually didn't exist when we started, or when I started 8 years ago. So we need these methods groups to really help us to develop the methodology. And these are people who also work sometimes with different review groups or sometimes with different Cochrane centers, but they also, their expertise tends to be methodology, and they tend to work on developing methods and advancing them so that we can move ahead with them. And I think that's a really important factor. And again, it's an important component to Cochrane, that there's areas of expertise of content, but there's also areas of expertise of methods. Fields tend to focus on specific dimensions of health that overlap with multiple review groups. So for example, you can look at we have fields which might look at what are the specific dimensions around primary care or specific settings. One of the easiest ones to explain is probably the child health field, because I think you can all appreciate there may be reviews related to the back group that would be on children. There may be, for that matter, hypertension that would include children population, but also adults as well. And what these fields are able to do is to make sure that the needs of the specific field or the specific type of consumer are dealt with within the reviews that review groups are putting at it. So they just can make sure they can address specific issues, whether it's a consumer or a type of intervention. Again, really valuable and really helpful to provide perspectives that a lot of times if we're doing a review that covers all consumers, we don't think about the specific aspects that children would have, and the child health field is really, that's their area of expertise and really helpful to be able to do that for us. Centers, as I mentioned earlier, they tend to be regional, and they are regional, and they're very focused on helping promote the awareness of the Cochrane collaboration in the Cochrane Library, and also providing training and translation and other activities for people in their specific region. So it kind of gives Canadians or Americans or Australasians a center where they can specifically focus on and get resources from. Really offer a lot of training, such as things like this webinar, but also workshops and that sort of thing to be able to train people in Canada or in whatever country we're talking about. But they're not specific to any content area, so they will help to provide training in Cochrane Reviews, but related to them generally for people in the regions. The other thing they do really well is they establish partnerships. I think you can appreciate there's a lot of different content areas of Cochrane Reviews, and it'd be really hard to for everybody to try and contact all the different policymakers within specific countries. And I think by having centers, you're able to establish those partnerships more easily and through a central location. I'm just looking at time here. This time I like I'm talking slower than I usually do. And then we have a consumer network. We do support consumers within the within Cochrane collaboration, and a lot of times we are asking for consumer input on different reviews through plain language summaries, through what are the important issues, that kind of thing. And this also helps us to facilitate the dissemination of the information to both patients and families, but also to get information from these groups before we start the review, so we're able to maintain the, address the important issues in the content. So as you can see here, there's a long list of the 10 principles of collaboration here, and I don't think I'm going to go through them all, but I will touch them briefly. We want to build on the enthusiasm. I mentioned collaboration earlier. Build on the enthusiasm of individuals because we involve and support all sorts of different people with different skills and backgrounds. Avoid duplication as much as possible. Well, we're not. Part of the challenge is that people are trying to do reviews that sometimes are similar to ones that exist already, and we have to be really careful that we don't do that because we're not trying to get duplicate reviews. And I guess this gets back to the whole transparency issue I brought up earlier. By being really transparent, we can tell which reviews have been done before. Try to minimize our bias using approaches such as scientific rigor, ensuring broad participation, avoiding conflicts of interest, or at least being transparent about the conflicts of interest, and as I mentioned earlier, developing our methods. Keeping up to date, one of the recommendations of Cochrane is people will update their reviews on a regular basis so that any new evidence that comes out that may affect the findings or may change the findings is both available and included within the review. Trying to do as relevant topics as we possibly can. Promoting access, again, this is done through different organizations. There are some countries where the Cochrane Library is provided by those countries, and others where people can only access abstracts and plain language summaries. This is something we're continuing to negotiate with our policymakers and government bodies about doing. They're also available within all low middle income countries. Ensuring the quality of reviews, again using these different techniques that I talked about earlier, such as bias, continuing to develop our methods, addressing risk of bias, these kinds of things, and being open to criticism and suggestions and trying to stay on top of the literature as to what the latest methods are. Continuity, we want to ensure that reviews are being maintained and that authors are continuing to stay involved with them, and enabling wide participation. I mentioned earlier that we have the international focus where we try to involve people from all sorts of areas as much as possible. I missed one, sorry. So you can see from this map that we have Cochrane activities in all sorts of different areas around the country, both Cochrane centers, but this would not include all the authors that we have or all the review groups. Where you can see we have a lot of activity going on, and it's really nice that the world has gotten a little bit smaller through email, webinars, and whatever, and we're able to do a lot more communication with people in different regions and partner up people together who might be working in both Canada as well as Australia, and have these people work together, and that's really been advantageous for us as an international organization. So the Cochrane has an international meeting once a year on an annual basis, and we're lucky enough that this year's is going to be in Quebec City. So this is one of our paid announcements, actually not paid. One of our announcements, just to encourage you to come to Quebec City. It's always a great meeting, really good chance to meet some of the international collaborators that are working in the organization, but also to get a feel for what's happening and some of the activities we have. Okay. So I've got a question slide here that we just threw in. We've got time for a couple. I don't know if anybody has any questions they want to go at here and throw into the chat, or I can just move on. So I'll give you a minute here to do that.
Al, we do have some questions. Can you hear me?
Yes,
okay.
I can, Eileen. Thank you.
One of the questions was, apparently a nursing student wants to register a systematic review. So how does she go about this? And this person, Michelle, was wondering if this was going to be covered in today's session. I don't believe it is covered in today's session. Am I correct?
That would be, yeah, I don't believe it is either.
That's right. I think it's going to be covered in the next session, talking about getting started on the Cochrane Review, where we will look at really the review team, title registration, and resources for review. And then finally, in the third session, is really taking a look at the steps of a Cochrane Review, turning a question, defining your question, then turning a question into a title and a protocol with eligibility criteria. Okay, so Michelle, I hope that helped to answer that question.
Irene, can I just take it for 2 seconds? The first thing you need to do, Michelle, is to make sure the topic hasn't been covered already. Okay, so what you need to do, the first thing I would do is take a look in the Cochrane Library and see that the topic has not been covered. And if it hasn't been covered, I would then defer to what the presenters will be presenting in the next 2 weeks. But I think that's probably the first thing you need to do. We often get people wanting to do a review and the topic's already been done. So that would be my first suggestion. If it hasn't already been done, then I would agree with Eileen. Let's sort of see what comes out of it in terms of next week. Or you can email me and I can take care of it offline.
Okay.
Thanks.
Another question that came up was who can undertake a review question? And there were a number of people involved in the chat saying a medical librarian, physician, research consultant, nurse. Perhaps I can get you to expand on this a bit, Al.
Sure. A really good question. There's kind of two conflicting answers, unfortunately. The one answer is we want to get people involved, and it's really good for people to get experience by writing Cochrane Reviews and becoming familiar with them. The counter-argument is these are not easy to do, and they're really challenging. And one of the struggles we have when we're making a decision excuse me, about accepting or rejecting a title is how experienced the team of authors are, and whether they're going to have the experience and the training to be able to carry out the review, because these can be really challenging to do. We don't have specific criteria, but we do like to see teams that have an experienced person on their team. So if I was a brand new grad looking for some sort of academic activity to be involved in, was thinking of getting involved in a Cochrane Review, I think I might find a topic I was interested in, email the particular review group and say, is anybody looking for any additional help on this? To sort of, at first, join an existing team, because a lot of times an extra body is really helpful. But if you join an existing experienced team, then maybe you can help them get the review done and you can get some experience and sort of move from there. We do like our review teams to include somebody with statistical expertise. The librarian sometimes is part of the team, but we also have trial search coordinators based with each Cochrane Review group, so sometimes that support is there. We like to see content experts, and we like to see experienced reviewers always member of the team. So I hope that was helpful.
There's also another question kind of related to that, and that was, let's see if I can find it here, about the number of people involved in a review. Must you have 2 authors at least, or can one do it alone? And I think you helped to answer that question, because it is so broad. You do need content experts and people that have specific skills.
Yeah. Minimum, bare minimum of 2. And it's not, depending on the review group and the question, even 2 isn't going to guarantee you're going to get accepted. There's a couple of issues here. One is you need at least 2 people if you're going to do any sort of risk of bias, as well as any screening and data extraction, because we ask you to verify your results, and one person cannot confirm that they did it correctly. Second thing, depending on the question or the topic, is that whole international collaboration issue. That maybe the question is a little bit different in the UK than it is in Canada, even though it's the same question. If that just made any sense, probably not. But you see, I think you appreciate that with different healthcare systems or different types of interventions, maybe in one country a nurse does a certain behavior, and in another country it's always done by a physician. So So unless you're based in the two different countries, you wouldn't be really as aware of that. So it's that kind of thing that we encourage you to get international collaboration. Bare minimum of 2 people, but usually more.
Okay, thank you, Al. We do have another 2 questions, but I think perhaps we'll move along with your presentation and then take the 2 at the end.
Okay, that's fine. How's my time? Wow. Okay. Sure. Thanks, Irene. I'll just go on then. So, real easy question for you. Have you ever accessed the Cochrane Library? So, let's just have a sense of what we're looking at here. I guess I should be glad that at least halfway through this talk nobody answered B, that said they've never heard of it, so that's good. And we're looking at most people are in the B category. Yes, seldom. Okay. All right. And some, no, it's still the same, but pretty close between A and B. That's great. All right. Thank you. So this is a screenshot when you log into the Cochrane Library and try and get a sense of what you want to, of the information that's available there and what you might want to search for. You can see here that there are certain special collections that we try to identify topics that are specific. We are now developing some editorials that people can able to see a bit more information on the Cochrane Library. And then you can also browse by topic. So if you're particularly interested in child health or particularly interested in ear, nose, and throat conditions, you can go into this area and then browse them. And there's obviously more categories here. Okay. Right now published on a monthly basis and updated every month. So this is one from February 2013. Okay, I think we've covered this already, so I'm just going to go right through it because I'm running out of time because we've covered that. So, why systematic reviews, and what are their aims, and what purposes can they serve, and how would a review help you? First of all, it's a really efficient way to access the body of research. It saves somebody who wants to know what the current status is on antihypertensives to treat hypertension. They can find specific articles that cover all the information, so you don't have to search for additional studies yourself. It does tend to provide a critical appraisal of the available research in that area and an overall interpretation of the results. Allows you to explore the differences between the studies, because a lot of times when you're looking up something, you'll see some results say a drug works and some results say it doesn't, and how do I actually know what the difference is. And then provides you with a reliable basis for decision making. Again, we hope it's an unbiased selection of the relevant information and it's useful for healthcare policy and for future research. So some of what we consider to be the features of a systematic review. Okay, there should be clearly stated objectives. I sometimes show a slide with a window that makes it really easy to see through, but you need to be clear. You need to be able to understand what the authors are trying to do. Okay? There needs to be predefined eligibility criteria. These are the studies we are going to include. Maybe it's design, maybe it's because of the population, maybe it's because what they're defining as the intervention. But you need to define what your eligibility criteria are. There needs to be an explicit reproducible methodology. So again, if I tried to do the same review, hopefully I would get the same results, including a systematic search. There needs to be an assessment of the validity of the included studies. So did this, what are the strong features of the study, what are the weaknesses, and how to be really helpful. And some type of systematic synthesis and presentation of the findings at the end. Okay? Now, again, I think I probably brought this up before, but I'm going to bring it up again. One of the important issues is not so much whether it's right or not, it's more that it's transparent. Okay, so I might not agree with what the authors are saying is the best eligibility criteria. Okay, maybe they decided to include a certain study design and I don't think they should have, and whatever. So that's fine. I accept that I'm going to often disagree with authors, maybe not often, sometimes disagree with what an author has done. But the point is they're clear and they're explicit and they explain to me what they did and why they did it. So whether I agree or disagree with it is one factor, but the other factor is I understand how they got the results they did because they're being clear in their methodology. And I just think that's a really important point. There is a handbook. It's not small. It's a fairly long book, and it's really helpful to read. And there are strong suggestions in it about the approaches you should follow. Okay, it's really essential guidance, and I suggest all of our authors read it. It's free, available online. You can also purchase a hard copy from Wiley. But if you just go to this link, you should be able to access it, and it's free on the Cochrane Library. Or free online, rather, not in the Cochrane Library. How do we conduct a review? We need help, okay? There's a lot of these people who can get involved. We need translators. Frequently we'll identify studies that may be published in a language other than English. And it's not uncommon for me to get an email from somebody saying, look, I'm desperate for an Italian translator, you know, to A, decide the eligibility of the study, and B, if it's eligible to do the data extraction. So that sort of stuff's really important. We use peer reviewers, and it's often, and they fill a very important role because they haven't been involved in the review before, and they're able to take a look at it and say, yeah, this is a key issue, the authors missed this, or this isn't presented right, or whatever. And for those of you who may be looking to get involved, this is sometimes where people will start as well as a peer reviewer, you know, and just to get some experience reading the kind of reviews that we have and evaluating them. We are always looking for content experts, methodologists, as I mentioned earlier, consumers, I mentioned the importance of them. And some reviews actually include review advisory boards. These aren't really authors, they're just sort of people who are a bit arm's length away from the review, but able to provide the advice as it goes along. Where can I learn more? Well, you can attend the next couple of webinars, which can give you a little bit more information on it. There is a standard 3-day author training workshop that's being offered by the different Cochrane centers. I mentioned earlier it's the centers who do the regional work. I know there's one, I'm pretty sure you can find them out through the website. I know you can find them out through the website here, through the Canadian Cochrane website. I know we're doing an author training in Hamilton in August, and then we're doing some more in other areas of Canada in the fall, I believe, as well. Normally there's an annual Canadian Cochrane Symposium. Clearly we're putting all our energies into the international one in Quebec City this year, so there's not going to be a Canadian one, but we'll stay tuned, and I'm sure we'll be having one in 2014. And then the International Colloquium is another opportunity where you can learn more. And resources, lots of resources online in terms of Cochrane. The library is where you can find the reviews that have been published. I mentioned the handbook earlier. The different Cochrane centers, this is the website for the Canadian Cochrane Center, but if you go to cochrane.org, you can find the website for any of the Cochrane centers. As well as the Cochrane centers, all the review groups have websites as well. So again, if you're interested in doing a review on psoriasis, you would then try and find the Cochrane Skin Group and find out where their website is and get some information from them on that particular topic. So there are group-specific websites as well. So I'd like to thank Miranda for her slides and the work that she's done on them, as well as the staff of the Canadian Cochrane Center have helped out with them as well. And next week, for those of you who are asking specifically about, you know, what the process is and learning a little bit more and how to get involved, it would be worthwhile attending the presentation on the steps of a Cochrane review.
Okay, thank you. Thank you very much, Al, for your presentation. So let's give Al a round of applause for his presentation. We have some time for some questions. I do have some questions that I've taken from the chat room that I'll present to Al. And I'm waiting for more questions to come through. In the meantime, if you take a minute to complete the evaluation, the link is just being sent to the chat room. We would appreciate that. Now, some of the questions, also I should just mention as well, in order to receive a PDF of this presentation, anyone who has signed in with their first name, we definitely need your last name, so please place it into the chat room, both your first and your last name, and we can email it to you. Otherwise, we don't know who Jane is, really, because we might have a few Janes on the roster as far as registration. We don't know who attended. Now, we do have some questions here. Do the same people update the review that first wrote it? And what happens if one of the authors no longer wants to continue with updates? Alan?
I could like to say we put them in jail. Sorry. This is one of my biggest challenges, getting people to update their reviews. There's no doubt about that. Normally, yeah, what the expectation is, if you've taken on a review, then our expectation is you will continue to update it every couple of years, and that's part of your responsibility. Having said that, if there was a topic you were interested in and the author has not updated it in 3 or 4 years, what I would be tempted to do is to email the review group and say, I'm really interested in this particular treatment for psoriasis. I've done a lot of work on it, and I understand the Cochrane Review has not been updated. Are the authors planning to update it? And then I think you could say, then I think the review group could make the decision. Maybe they'll contact the original authors and see if you could join the team. Maybe the original authors have decided they really don't want to do it anymore and they're stepping right back from it. You know, so there are options like that. We do often have new authors get involved in existing reviews to help them to update that.
Okay, thank you very much, Al. Also, there's another question. Is there any way of accessing earlier reviews on the same topic?
That's a good question. I need to look that up. I just saw that in the chat room. I need to look that up, and if I can get back to you. So if you can take note of who that person is. I think there is, but it depends how old they are. And if there's only certain, I think they're available on the Cochrane Library, though, is what I think. But I'd need to look it up. So if you email me, Eileen, I can follow up with that after.
Okay, I'll make sure that I have that person's name then from the chat room. And I think you've covered this one. Can non-registered authors get training in how to before you register as an author, which you mentioned there are various training sessions throughout Canada, and you can attend one of these 3-day sessions. It really gives you a good background as to what is being done in a review, and also what is needed and how you move forward. Anything else to add?
Can I add something to that, Eileen?
Please, yes.
There's some places that will give priority to authors with a registered title. Okay, so the answer is yes, you can get the training, but often it depends on where it is. And in some places, I know in the UK, it's really hard to get into a training workshop unless you actually have a registered title. Mm-hmm. So there are places that will give priority to people with registered titles, but often in Canada we haven't had that. Not that I'm aware of that being a problem.
Okay, so as a follow-up to this, somebody asked, how can I join an existing team?
You should email the review group for the content area that you're interested in. So if your area of interest is wound healing, there's actually a Cochrane Wounds group based in the UK, and just say, hi, I'm really interested in getting involved in a Cochrane review on wound healing. Is there a team who you know who might be looking for some additional help, that I can help with extraction or screening or whatever?
Okay.
So I would find the content area you're interested in first, and then email that specific review group, explaining to them why you're interested in that particular content area.
Okay, and another question, if person does not have a subscription to Wiley, how to best view the full articles or reviews? Do you have any suggestions, Al?
My first suggestion would be to try and access it through a university library, because most of them will have access or licenses to the Cochrane Library. If you have alumni status at different universities, that's a possibility, and then I would, contact them and say, is there a way that I can do this? That's my first suggestion. I don't know if public libraries have access to Cochrane Library or not, or how many of them do. I suppose some probably do, but I don't know for sure. But I think academic libraries is where I would start. And then I would also encourage your hospital or your facility that you might be employed at, if you're a healthcare professional, to also think about getting a subscription to the Cochrane Library. This is an issue in Canada, and Eileen can probably tell you more, but I know the Canadian Cochrane Centre is well aware that we don't have a Canadian license yet, and it's something we're continuing to work on.
Yes, I know that's not perhaps the most satisfactory answer, but at the same time, that is reality, I guess, as we know it right now.
Yeah.
I do have another question about author training workshops. Do you think they'd be of value if you were not really interested in writing a review, such as maybe just generally helping with critical appraisal skills in reviewing literature?
Yes, I think they would. I think you'll have to understand the focus is going to be on writing a review. Okay, I think generally education is really beneficial for anybody. And I think you're going to learn stuff by attending a Cochrane author training workshop. But it will be very focused in that particular area. And what you'll probably find is that you'll get more than you need to know, is my guess. But I don't think, if there was room and you were willing to attend, I think that'd be great. And I think they're really good to get a sense of how Cochrane Reviews work and a lot of information about systematic reviews in general. But it is very in-depth. It's 3 full days, and they're pretty intense.
Okay, thank you.
Do you want to add anything to that, Eileen?
No, I think you're definitely you're bang on with your assessment of the author training. So for some people it can be a little bit overwhelming, but at the same time I do think it gives you more than just a glimpse into what goes on in a review, and you will definitely come away with more knowledge. Mm-hmm. There is another question too. Are the two should authors be from the same country, or the Cochrane collaboration, are the 2 authors should be from the same country, or the Cochrane collaboration duplicate the research blind side to see if the review has the same result? I'm not sure if I really understand that question, the way it's coming through. Sarah, perhaps if you could reword that would be...
Let me just touch on it a bit, Eileen. Okay. I appreciate it is difficult to establish rapport or relationship with someone in a different country if you're, a Cochrane author and you write them. What I would probably tend to do is, again, discuss that with your review group and the managing editor who's there, okay? Because they would have a sense of the kind of questions that really need international collaboration. And they would also have, I have lots of names and email addresses of people in different parts of the world who are interested in different topics. And more than once I've recently set up a person from Brazil with someone from Newfoundland, because I knew the person in Newfoundland was an experienced author and was interested in this content area because it's similar to one she's done before. So actually what I would do is you can get your local team together, but you may want to discuss with the managing editor of the review group whether you need international collaboration on that particular topic.
Okay. Thank you, Al. Do you have a couple more minutes?
Sure.
Okay. Somebody wanted to know if they all function in English. I assume it means the review groups.
Yes, we do. We do for the most part, and the Cochrane, although there is translation services available for a lot of Cochrane reviews, especially the abstracts and the plain language summaries into different languages, we do work in English. And I would say that most of the Cochrane review groups do. Now, having said that, if the Cochrane review group is based in Italy, and I would expect, I'm pretty sure they speak Italian really well, so they're not all based in English-speaking countries. But for the most part, yes, we do function in English.
Okay, another question. Is there a difference between Wiley's Cochrane Library and Ovid's Cochrane Suite, which includes the Cochrane database of systematic reviews?
Not that I know of. I wouldn't have thought so. No, I would say not. I've never looked at the Ovid one. Once again, I can find out and get back to you. But my sense is no, there isn't a difference.
Okay. And let's see, again, somebody's asking about, well, how does the public access Cochrane? And I know, of course, the public does have access to the abstract and plain language summary, perhaps not the full review. Do you have something to add there, Al?
Just a second. Sorry, can you repeat that one, Eileen, for me again?
Yes. Yeah, since we, say, for instance, in Canada, do not have access to the full review, someone is asking about public access to Cochrane. And as I mentioned, the public, without a subscription, you do have access to the abstract and the plain language summary, but not to the full review.
The best answer I can give you is those are better than nothing. But you're right, the public generally does not have access, unless the library are affiliated with an academic institution or healthcare facility that has a license to the Cochrane Review. So if they don't have affiliation with academic or healthcare facilities, then they don't have access to the Cochrane Library. Now, having said that, more than once I've talked to friends, colleagues here in Canada, and said, you should look in the Cochrane Library before you start taking that medication or before you go see the specialist or whatever. And they've been able to get sufficient information for them from the plain language summary and the abstract. So I don't think I would say, I mean, obviously you're going to get more information in fuller detail with the whole review, but I think a lot of people, the plain language summary and the abstract, that's really good information, and they're happy enough to get that. I don't know if you want to add anything to that, Eileen.
No, actually, I've found, certainly in my experience, both the public, basically healthcare consumers, and also a lot of the healthcare practitioners, whether they're physicians, nurses, physiotherapists, etc., they do tend to use the abstracts and the plain language summaries often for a quick interpretation, as well as sometimes even to help with the plain language summary to explain it to their patients.
Right, yeah, absolutely.
And finally, there is another question talking about critical appraisal tools that are used for systematic reviews. I think that we could do definitely a whole other session or two on this one, and I think that some of them will be covered perhaps in the next two sessions. But if you have anything to add to this answer for the question,
I'm just going to be really quick. Cochrane has a very specific risk of bias tool. Okay, that's what we use for our critical appraisal. There's very specific criteria that we use, and if you take a look at any Cochrane review, you can find it under the risk of bias assessment. Okay, so that's what we use for quality assessment or critical appraisal. Oftentimes there's more components to it, but there are core risk of bias components that we use. So thanks, May. It's a good question. It's way more, like Eileen said, it's about a 2-weeker. You know, I could talk for 2 different sessions on, but for today, that's what I can tell you.
Okay, well, thank you very much. I think that ends the questions, certainly. And I'd like to thank everyone for joining us today. We really appreciate your time and participation, all your questions. And thank you, Al, too, for joining us and for speaking and answering the questions as well. And we hope that everyone would be able to join us for the next session or two next week and the week after. So thank you, and hope to see you soon.